Welcome. The purpose of this video is to explain the lung transplant evaluation process. Your lung transplant evaluation is a 4-step process. First, you will meet with your transplant pulmonologist for a transplant consultation. Second, you will complete your medical testing. Next, you will meet the rest of your transplant team. And finally, the transplant committee will meet to review the evaluation findings. Your nurse coordinator will be your contact person throughout the evaluation. At your transplant consultation, you will meet your transplant pulmonologist, a doctor who specializes in advanced lung disease. Your care partner should also be present with you. Here, you will discuss your medical history, learn about the transplant process, and receive a recommendation for next steps in the process. The next part of the evaluation is medical testing to evaluate your overall health. Medical testing may include X-rays and CT scans, swallowing studies, cardiac testing, blood tests for kidney, liver, infections, and blood type, tests for physical endurance, and other tests for overall health. You will work with your coordinator to schedule testing. If you've recently completed these tests, please inform your coordinator. Delays in workup could result in delays on getting on the wait list. You should also provide documentation that you are up to date on other health maintenance, including routine vaccines and cancer screening. Next, you'll have consultations with the full transplant team, including the transplant surgeon, the social worker, and the dietitian. You may also talk with a financial advocate, psychiatrist, and other medical specialists. Once your evaluation is completed, the transplant team will review your case at our committee meeting to determine transplant recommendations. Based on your risks versus benefits of transplant, you will either be approved for transplant listing, declined for transplant listing, or on hold for additional information. Your coordinator or doctor will discuss the recommendation with you after the review. There are many reasons to be on hold, such as additional testing, treatments, physical therapy, or substance use program participation. Please provide documentation to your coordinator about the progress or completion of these steps. You can ask for a second opinion from another transplant center if the team decides that transplant is not the best option. If you are approved, you will be added to the waitlist, and your transplant team will inform you of the next steps. If you have any questions, reach out to the transplant office. Your transplant team is here to support you.